third year. Right now, I'm in fourth year, but I cleared my USMLE Step 1 exam back in November 2025. And the idea of doing this session came from my UWorld practice and my MBOS practice. When I was practicing the ethics questions, I always used to get them right. And when I used to discuss it with the people from the other countries and the other people preparing for the Step 1, they really used to wonder how I'm able to score or mark good answers on ethics questions. So in this webinar, I'm going to talk about the things. Either you are a beginner or either you are at the very end stage of your step 1 preparation. The things I'm going to discuss will really help you out while doing the ethics part on your actual exam. And before we go ahead, if you got any questions or anything in between, you can write down in the comment box or even you can share in the WhatsApp group. I'll try to cover that up if it's relevant to the thing we are discussing. So, as far as the ethics is concerned, you will see the word public health sciences in first aid, right? In public health sciences, you have three sections. First one is biostats, the second is ethics, and the third one is public health in itself. When you talk about the proportion of this whole thing, there are almost 7-8 MCQs from this entire portion, biostats and public health and ethics. But when we segregate ethics, you always get 3 to 4 questions on your exam. Recently, like from last year, people do say that they get a lot of questions from the ethics on their exam, and they are quite heavily tested. Even in my exam, I saw 5-6 questions on my exam on every block. Like I had a lot of ethics questions on my each block in my exam. So just to start with, we'll talk about the proportion of ethics on step 1. It could be your power, or it could be your strength in the exam, or it could be something that can really move you towards the other side of the cliff, right? So there are 3 to 4 questions on average in every block. Yeah, 5 to 6 questions, the whole public health science portion. It includes biostats, it includes ethics and public health science. But as far as the ethics is concerned, you will get 3 to 4 questions on every block related to ethics. And in the entire exam, you'll probably get 20 to 25 questions, 20 I would say, because there are 7 blocks, and you can assume there are almost 20 questions in the whole exam related to ethics. Now, when to start preparing for the ethics? So, my recommendation would be, if you are a very newcomer or a very beginner with the step preparation, to start with the ethics is not really a good choice. Like you can do ethics while you are done with some of the systems or some of the subjects, and then you can do the ethics part. But if you are in a very start of your preparation and you think you should start with the ethics, so it's not really a wise thing to do in the very start, because ethics is not something you invest a lot of time. Rather, you do a lot of practice in the ethics portion, right? It's like there is nothing that you have to cram a lot or memorize a lot. It's just getting familiar with the pattern, and I think I will discuss the whole thing in the next slide. But the right time of preparation is after you are done with the 50% preparation of your step exam. Then you can take ethics religiously alongside with your studies. Now I will talk about the resources. First aid is literally very ideal resource. It contains a lot of content. You will hear people saying, okay, you should read the 100 cases of Fisher and these sort of notes and these and that. But what I would say and what I did was doing first aid religiously, understanding what's written in the first aid. And I think that's more than enough. Plus the practice, that's more than enough, rather than surfing or skimming through some random notes and some random things. Then the second suggestion would be to do the dirty medicine ethics playlist. It's literally gold. Like the things where you stumble at in your exam, or the things, the points, the loopholes, or the places where you can really go wrong. Those points are really covered by the dirty medicine ethics playlist. Like it really tells you where your weakness is and where you have to put your focus in. So a dirty medicine playlist, I will share the link in the group, and you can look into it. Then as far as the question banks are concerned, in UWorld for now you have almost 105 or 106 questions related to ethics, and in MBOS you have almost 150 to 200 questions. So it's almost 250 to 300 questions overall in the ethics portion. So I would suggest you should do the both question banks. If you have got IMD or something like that, so it's really ideal for you. And if you don't got that, if you have only UWorld, then you can do MBOS. You can make free accounts on MBOS and can do practice on MBOS for the ethics. So these are the possible choices. But you should like explore both of these question banks as far as the ethics is concerned. And then at the last, Randy Neal, it's also a YouTube channel where he discusses some MCQ based scenarios on ethics, and that really helped me. Even I remember a week before my exam, I was watching Randy Neal's ethics videos, and they were quite helpful for me. So these are the resources that you can use for the ethics. Let's just move to the next slide. Okay, in this slide, I have discussed once you are doing some questions on ethics. So what is the thing, like her question, in every question you have some main theme or main key that you have to grasp, you have to pick and use that to unlock all the things in that question. So in the ethics portion, it's like you are not like most of the people perceive ethics is just your common sense, or it's like you have to choose the best possible answer and that's it. No, that's not the thing. When you are doing ethics, your every answer is based on some knowledge in the background and some specific pattern, patient care clear pattern that you have to study and that you studied somewhere, and then they are using that to make the whole scenario, and you have to answer the question according to that. It's not based on your gut feelings. It's not based on what seems right to you. It is based on what you have read and what you have practiced. So, but I would highly recommend before jumping directly into the questions, do search the literature, do take the lectures, and then move to the question bank or questions, and you'll get familiar to the things. If they are this is the right answer, what is the reason for this answer? Then there is a small activity that I'm going to place a question in the group, and you guys have to answer that question as per your knowledge. Okay, what do you think is the right answer? Just give me a second. I'll put it in the group. You have 2 to 3 minutes. You can read the question and select the option, whatever seems right according to you or what you think about it. If you haven't started preparing for the ethics yet, you can just randomly answer the question you think is right, and then we can proceed. And I will tell you, okay, how you proceed with that question. Okay, perfect. I could see the E that is chosen by everyone, and that's absolutely correct. Now, whenever you see an ethics question in your exam, it would be quite similar to the questions you see in the UWorld or your MBOS or any other question exam, or even in the NBME exam. Once you read 1 or 2 lines, or you'll skim through the option choices, you will get to know it's question from ethics. Now, once you get to know okay, that this is a question from ethics, you have to read the entire stem. You don't have to read the last 1 line or last 2 line like you usually do for the other questions. Because for you to get the context, you have to immediately jump to the statement at the very first line and quickly read it like the whole paragraph. Like in the actual exam, you have 90 seconds for a question, right? So make sure whenever you see a ethics question, you quickly jump to the very first word and start reading from there. Because if you start reading from in between or from the last line, ultimately you have to jump again back to the very first line. So it will waste your time. So the strategy I used in my exam was whenever I saw an ethics question, I used to read it from the very first line. And if you have done quite practice in these questions, you will get an idea. No matter how much you read, like you cut short the question, you have to read the full question. So make sure you always read the full question. And when I read the full question, I will get to know okay, what is being asked in this question, right? So can anyone tell okay, what is the main topic this question is testing? Like you guys answered E and like unanimously answered E. So can anyone tell me okay, which topic this question is testing? Okay, so this question is yeah, this question is testing the autonomy. Yes, number one, autonomy, and the second thing it's testing is the advanced directive. Like the patient already told K what you have to do. That is called the living will. You either call it the attorney power or whatever thing. The will, the patient already declared that, and once the patient declared that in the hierarchy, like whatever the other person says, the relative says, or even his parent says, or his sibling says, or neighbor says, whoever, it doesn't matter. If the person has stated about anything about his death will or anything, you have to follow that in the hierarchy. Then in the hierarchy, then there comes the will that is written. Then there comes the very close relative, for example, your parents, and then sorry, after your living will comes the directive that you have verbally given. After your verbally given directive, there comes the your children, and in children the eldest sibling, and then comes your parents, and then after parents comes your own siblings. So that's how you proceed with the hierarchy, and this is this whole topic in the first grade. Yeah, spouse. The spouse comes. Yeah, yeah, exactly. After the living will, the spouse comes, and then the children come, and then the parents, and then the his own siblings. Yeah, her own siblings. Yeah, and then the neighbor or something like that comes in the hierarchy. So that was the thing. If you have read that topic and if you know about that hierarchy and you see this question is really a piece of cake for you. And trust me, I got a lot of questions like this in my actual exam, and I was quite familiar that I have read that topic in the first grade. I know the hierarchy and I can easily answer these questions. So once you have a good grip of a topic, you don't need to worry about the thing. Now again, there comes the other part. Like you have seen the statement and you get confused. Like there is a very big statement in that question. So whenever there is a big statement or there are 2 or 3 statements in the question, you have to split the statements and you have to see either which statement, like which part of the question is the basic answer. So here the basic part of the question was like the basic answer was we should follow and respect her wishes, right? So can you see this answer anywhere else? You can't see this answer anywhere else. So you will use this answer as a hint and choose this option. And you will at the time forget about the first statement, that is we are doing everything possible to help your wife recover. This is one thing, right? And there are certain questions, I haven't seen any question like that. They have tested the both statements. They usually check or test only one statement. The other statement is a complementary statement. But for instance, you get a question where they are testing 2 or more statements. What you will do? First, you will identify, is this option common in any other statement? If the option is common, then you have to look only on those options, exclude the other options. And once you have excluded the options, you are remaining with the 2 options. Now you have to follow the principles of spikes and pearls. I have written the other slides and talked on those principles. Those principles simply say that whenever you start a discussion, you will do empathy with the patient. You will make him feel good, and you will try to understand his state, his stance, and his condition, and then you will proceed with whatever you are doing or whatever you are saying. So the principles do apply whenever you are choosing an option. It's not arbitrary or it's not that much random when you are choosing an option choice. So I hope you got an idea about this. Okay. Next, this you have seen this thing quite a lot of times. Patient-centered care. Like, what is patient-centered care? The patient-centered care is whenever you are making a decision, you will do it in the favor of the patient. For instance, there is one common scenario on the questions and even on the NBMEs. There is one colleague of yours and he is very irresponsible of his responsibilities. Like he was drunk and still he was on the duty and he was seeing a patient. What you will do? So your first stance would not be like you have to protect the privacy of your colleague or you have to protect him or something like that, or it is professional ethics and you should not disclose him. No, you have to focus on the safety of the patient. You will report the incident and the colleague to the medical ethical board, the ethical board of the hospital, and like move the whole thing into their notice because the life of a patient was at stake, right? So at these situations and circumstances, when you have no idea where this question is coming from, you will always choose an option choice where the approach is patient centered. Number one thing. Number two, never breaking the predefined guidelines. This is another thing. Now, there is one scenario you might have seen on the UWorld or a lot of question banks. There comes a patient and he is asking for a drug, like he is asking you to prescribe a drug, but the drug is not really needed by the patient. Like he might be addicted to it, or he might be selling the drug or something like that. So at that time, you will not try to be patient centered. You will try to stick to the guidelines. Like the guidelines strictly inhibit you or restrain you to give any sort of medications that are not needed, but still the patient is asking you for a favor or anything like that, so you will not listen to him and you will follow the rules. So you will never break the rules on ethics questions on USMLE. Then the third thing is exceptions exist and you have to remember them. Yes. So there are certain situations, like we always talk about confidentiality, but there are certain situations where you have to breach the confidentiality. For example, if there is some reportable disease or something that can spread, so you have to breach the that confidentiality. Similarly, there are certain scenarios and situations where there are exceptions to the general rules, and these exceptions are very well written in first aid. Like when you skim through the first aid, it exactly tells you where is this limitation and where you have to cross this line, or where you don't have to. For example, Jehovah's Witness. So anyone has an idea what it is? I look forward to see something in the chat box. Okay, all right, all right. Well, it's quite there, like famous on NBME forms and even on the UWorld and AMBOSS QBank. So Jehovah's Witness is related to blood transfusion. So what the Jehovah's Witness is, like these are certain this is a certain sect of Christianity, and these people really don't believe on blood transfusion. Like it's prohibited in their religious beliefs, right? So whenever a patient comes to you and you have to transfuse them blood because they are very unstable, and when they say they are Jehovah's Witness, like they will not allow you to transfuse them. What you are gonna do? तो अब यहाँ पर ये एक्सेप्शन आ जाती है कि like it's an emergency situation. So what you will do in this case? The answer to this question is for the adult emergency, for the adults who are Jehovah's Witness, although they are in emergency situation, if they are denying for any sort of help or any sort of blood transfusion, you won't transfuse them any blood. For example, there is this one scenario: you have a wife and a daughter who came with very severe blood loss, and they are in a very critical situation. But the husband, the whole family is a believer of Jehovah's Witness, and the husband says, "We are the believers of Jehovah's Witness. We don't allow you to transfuse blood." So what the doctor would do? The doctor would transfuse a child because the child is a minor, and for minor you have to save their life regardless of whatever their belief is. But for the wife, for the women, she is adult, and for the adult, although she's in critical situation, if they are denying the blood transfusion, you have to respect that. You have to respect the autonomy. So now these are the principles that are interrelated with each other, and this was the exception that is clearly written in the first aid. And when you read the first aid, you will read about the Genova's witness, and this scenario is quite often seen on the exam and on the Cubans. So these are the exceptions, and that you have to read and that you have to know about. Okay, let me drop another question in the group, and then we'll discuss the question. You have got 2 minutes. You can mark the answer, and then we can proceed. Okay, so let's get ahead with it. So most of you people answered B, C, D, and E. Now, see where you did mistake and where you have to focus on. You read the whole question, and the crux of the whole question was the patient was not taking medicine and the whole thing, right? You don't have to be sentimental. You don't have to be emotional when you are answering any question on ethics. You have to follow the rules. That's what I have stated. You don't have to follow your guts. You have to follow the rules and basic ethical principles that are stated in the first aid. So what does the first aid states? First aid states the autonomy, non-maleficence, beneficence, and justice, right? So where is autonomy? Like when there's a patient coming to you and he has his extended family with him, or he has his wife with him, or daughter with him, or son with him, or anyone with him, and they are telling the whole story to the doctor and telling him he's doing this, he's doing that, and then you are religiously following the thing they are telling you about him. That's wrong. You have to follow the whole procedure, and you have to follow the ethical principle. That is autonomy. The autonomy is the what the patient wants, right? You have to know about that, and for that you have to talk to the patient. If there is this common scenario on the USMLE questions that comes quite often. Okay, there is this one teenager daughter and her mother, right? And the mother comes and says, my daughter is like getting involved in boyfriends and everything and blah blah blah. So do tell her not to do this and this stuff, right? So what the doctor would do? Doctor would say the mother to please step out of the room so he could talk privately to her daughter and learn her stance, and then he will reach to any conclusion. So in this question also, like although the wife is telling about the whole situation and patient is seemingly looks like he's a bit out of order or something, but you always have to take the patient's stance. Autonomy is in there, right? So you have to talk to the patient and alongside and see which option gives you the right thing about that. The only option E gives you the thing about you have to discuss the things with the patient, right? And then alongside with that, you will be empathetic with the wife or with the wife of that patient, and will say, okay, I will consider your stance, but first I have to talk to this patient, and you are obeying the principle of autonomy in this case. So instead of randomly choosing the choice, you will process in the back of your mind which ethical principle this question is based on, and once you get to know about that, you will be never wrong in answering the question. So I hope you got my point in here. And if anyone got some question, okay, why we didn't choose B or C, and you can let me in the comment box, and I can give you very solid reasons for that. But I think the reasoning behind the question and answering that, I've already cleared about that. Okay. Now let's just jump to the very high yield topics from first aid that you must have to do, and you will read them in the first aid, but I will give you an entire summary of the topics and how they're going to appear in your exam, and what are the main things that you have to always keep in your mind while thinking about these topics or stuff. So I'll be dealing with these topics one by one. So number one is the ethical principles. There are four ethical principles. Autonomy. Every one of us know what the autonomy is, and we have already seen the example of autonomy. We always have to respect the autonomy of the patient, even if he is okay. There is this one scenario on the UWorld or on the patient banks that a patient is in a very critical situation in the emergency department, and he does not allows you to do his treatment. What you will do? So there are two possibilities in that. Number one, either you will do it forcefully. Number two, either you will leave the patient. So what you are going to do in that case? Can anyone give me a hint or his idea or her idea? What should we do being a doctor? So whenever you will come across these sort of questions on exam, they'll definitely give you an option choice where they will say, give him a discharge slip, or in the other choice they will say, convince him, and if he doesn't agree, then give him a discharge slip. While he's in a hospital. Obviously, he was injured in a road accident, and someone put him in the ambulance and brought him into the hospital. And when he's in hospital, he got some consciousness. He said, okay, no, I don't want any treatment. So this is the scenario, and this is what you will see in the exam and on the USMLE exam, and that's what you get tricked, where you get tricked, right? So in that scenario, you will try to, you will try to behave. Yes, you will assess his. Yes. Okay. Now you have to fulfill the responsibility of a doctor, and alongside you have to fulfill the responsibility of being an ethical doctor that is following the principle of autonomy. So if in the question they say, if the patient directly says, I don't want any treatment, so the doctor would say, would try to convince him, and then say, if he, and then the options will be would most likely be like, he will convince, and if he don't get convinced, he will give him a discharge slip. So that option would be correct. But if in the question they say, he tries his best to convince the patient and still he doesn't agree, then what you would do is you will not treat him. You will not treat if he is saying he does not want treatment. That means he is in his consciousness, right? And you will not treat that patient. So that's what you will do in this scenario. Yeah, he or she is in a critical situation. You will make him aware, okay, you are in a critical situation. If you will not get this treatment, it could be life threatening for you, and we really request you to please have this treatment. But still, if he says, no, I don't want this treatment, then you will not force the patient. Even if he is dying, you will not force him or her. So this is autonomy. Like if you're stuck in this sort of a situation, first you will try to persuade the patient, but if he's not, if he's reluctant to get treatment, you will not forcefully treat the patient. That's always there. Then justice. There is this one scenario. I have seen that in Amboss where there is this one patient, a white patient comes and a black patient comes, and white patient says, like he has some injuries in the emergency department, so he directly goes. While the black patient has no severe injuries or something that is very critical, so he has to wait there, right? So then the question they ask is, in this whole scenario, do you think the justice is like affected or something like that? So in that scenario, you will always get to know about the equality and equity. In such situations, you will always follow equity. You will not follow equality. It will be not like that. Both the patients will go to the emergency department and both have the right, both pay the equal taxes, so both should go to the emergency department. In this scenario, you will see the patient who is more critical will get the treatment first, and the patient who is not that much critical will not get the treatment as soon as possible. Usually, in the very start, I used to think it's United States of America, so definitely they have a lot of resources. So I think we should move both the patients in the emergency department because they have a lot of resources and everything. But that was my misconception. So whenever you see this question, you don't have to presume there are a lot of resources and there are a lot of medical staff in there. So you should allow both of these people to get in. No, you have to follow the principle of equity here. So the patient that needs more critical care will go, and the patient who needs less critical care has to wait. So this is what the justice is, and you will get the questions relevant to this thing. Then beneficence. In beneficence, this is something like how much you can give a benefit to the patient. For example, if there is some surgery, and it also correlates to the topic of consent, but if there is some surgery and you will communicate the benefit of this surgery, and non-maleficence is like these are correlated. Non-maleficence is giving no harm to the patient. So you will give the whole probability of what would be the benefits and what would be the losses for you, and then let the patient decide what is best for them. You will not hide the benefits, or you will not hide the harms or risk factors for any procedure or anything like that. So these are the core principles. Always keep them in mind whenever you are answering any question. Then confidentiality. Confidentiality is something that remains between the patient and his doctor, right? So now you will see a very typical scenario in question banks, like where a doctor is approached by his colleague or her colleague, and they ask about some patient. Okay, this patient is my neighbor, or this patient is my relative. So please tell me about his situation so I can help him out, or I could arrange something for him or her. So in these sort of situations, although they are professional colleagues, but once they are referring to some patient or something, they are involving the personal tie in there. So you don't have to disclose anything there. And there is this one aspect okay, you will also be you will straightforward say okay, even you can even not say this is my patient or I am treating that patient. So you will whenever they'll ask you okay, can you please tell me about Mr. X you are treating, he is my neighbor, I want to know about the situation. So what the answer choice would be, like in the answer choices you will get tell him about the patient. Number two, tell him okay, it is confidential between me and my patient, or either tell him okay, I cannot disclose any information, either he is my patient or not. So the third option would be right, that you even don't have to disclose okay, you are treating someone. Even the person has an idea that you are treating a patient or treating a particular person, but you don't have to say it by your own words. You are treating that patient. That also is included in the patient confidentiality. Okay, you can even not disclose that, right? So this is a very typical scenario that you will come across alongside. So this is like the scenario related to the confidentiality. Then there are few exceptions. Okay, when you can breach the confidentiality, reportable diseases. For example, a patient with HIV/AIDS comes to you, or some tuberculosis comes to you, or some sort of diseases that could harm the public health, you definitely have to report them. And what would be the right answer choice in those questions? You have to report them to the particular department. So that's how you will disclose that. There is this one very typical scenario that comes on exam, and that used to confuse me every time I used to do it. Was like there is this one patient comes to you, and he is a patient of some sexually transmitted disease, and his wife calls you and asks you about his patient. Now the wife is directly related and will be affected by that patient. So what would you do in this scenario, right? So in this scenario, you will tell her wife, okay, you will first ask you will encourage the wife to ask the husband or the person herself, and ask him about the situation or condition, and I cannot disclose any situation to you. So in that scenario, you will get this typical answer choice, and these are just the deviations or exceptions that I was talking about. Okay, how these are the situations when you will breach the confidentiality. And when you read first aid, if a pilot driving aeroplane is alcoholic, what would you do? Okay, if there's not the scenario like that, you are in the plane and you are a doctor and something like that, they'll definitely come to your clinic, and there are some sort of questions like these. I can recall a question. There was this question where a driver who had some sort of Parkinson disease or some sort of disease that results in seizures, right? So he came to you and said, I have this disease, but I don't want to miss my job or get unemployed. So please don't report this disease. What you will do in this scenario? You will definitely report that disease because the life of other people is at stake. So I hope you got the question. If someone is alcoholic and he drives the plane or something like that, and the case comes to you, you will definitely report it, because if the life of other people is at stake, you will report that situation or condition. Then let me tell you about some more cases of confidentiality breach. So yeah, there are suicidal or homicidal. There is this one very critical, typical scenario. Okay, a patient comes to you and he says, I'm going to kill that person. So what you will do in that scenario? You have to inform that person about the thing. So this is very tricky question on the question banks. So do remember this scenario. This is very typical scenario. You have to remember that, because I haven't seen any other examples related to this scenario. So whenever a patient comes to you and he has homicidal thoughts that he's going to kill some person, so you have to call that person and tell him about the risk factor, about the risk that your life is at stake. And there will be option of telling it to the authority or telling it to the police or something like that. So no, you'll not tell police or something like that. You will tell that particular person. So there's a lot of debate why you don't tell police, or why don't you tell the criminal crime associated agencies or something like that. But that is very typical of a question that you will see on NBMEs and on the question banks. And as I told, hepatitis, food poisoning, because like these all are the scenarios where they're happening at a very massive scale or the large scale, then you definitely have to report them to ensure other people are not affected by them. Okay, next we have is advanced directives. The question we already solved on this. What are advanced directives? So advanced directives, you have already a will, like before your death, you write something either to a lawyer or either to someone you believe on or you trust on, and this is the will by you. So this is number one, the very first thing the doctor has to follow if a patient is coming to him in an unconscious situation. So if he has some sort of a living will or some written statement, the very first priority is given to that statement. Even if his wife says, please save him or please give him this procedure or anything like that, she's getting very emotional and everything, you don't have to follow that. You have to follow the living will. Right, number one. Number two, you have to, if he has no living will, if he has any medical proxy or any assigned attorney, or he has given his power of decision making to someone else, and it's like legally given to someone, they'll not exactly say it is given to anyone or something like that. You will get an idea. Okay, he made someone a proxy, or he gave him a permission, or he told him, not even told him, but he gave him the authorities and something like that. They will mention this sort of statement in the question. So that will be the second evidence. After living will, if you have no living will, you will follow that person or that medical proxy. If you even don't have that person, the very third person you will follow will be the spouse. Like if there is wife, you will follow the command of the husband, and if the husband, you will follow the command of the wife. Even though whatever the children are saying or the parents are saying, it doesn't matter, right? In the third, there comes this, and number fourth, there comes the children. Now you will question, okay, for example, if there is some person, he has his father and mother alongside. If there is a written statement, no. there is a written statement and there is a proxy. So you will always follow a written statement, even though they are contradictory, or even though the proxy says he changed his statement or something like that. You will not getting trapped in that thing. Even though they say at the last moment he changed his will or something like that. No, you have to follow the written will. If there is no written will, then you have to follow the proxy. And the scenario I was discussing was like if there are parents and the sibling and the children, then whom you will follow. And when you will think about it emotionally, you will feel like parents are very close to a person, so definitely I should follow the parents' advice, like his father's or his mother's. So that's wrong. If he has children and they all are mature enough or adult enough, so you will first in the hierarchy, the children will come first, and after the children, the parents will come. If there are no children or something like that, then you will follow the advice or the suggestion of the parents, and after the parents, then you will follow the suggestion of someone very close, like a friend or some. But that only in that scenario if you have no one else around. And there is one typical scenario in the world where they say there is one patient, and he had his one sister living abroad, and now he is in the hospital unconscious with his neighbor, and neighbor says one thing about his health or decision making, and the doctor, what would the doctor do? So the doctor would call his sister that is living abroad, and although she is not in contact with the person, although she is not familiar with the situation, but still in that case he will ask her sister about the possible suggestions or possible thing they should go for. And if they are not able to find her, then they will follow the advice of the neighbor, even though how much the neighbor is close to them. So the closeness or something like that doesn't matter. Even if, for example, a friend of mine who spent 70 years with me says, "Okay, save him." And on the other hand, if there is one sibling of mine or a mother of mine or children of mine who just saw me once in my life and says, "Do not save him," so I'll follow the command of the children or his sibling, because that comes in the hierarchy. You have to always follow the hierarchy, and that is written in the first way, and you'll get to know about that. And once you solve the questions, you'll get a more deeper idea about that. Then there is consent. So in consent, you have to explain the entire situation to the patient. Either it is good, either it is bad, and what are the possible outcomes and possibilities, pros and cons, and everything. Now there is a very typical scenario. There is this resident doctor, and surgeon asked him to take a consent, and he doesn't know what the procedure is, and he has no idea. So what should he do? So he should ask his surgeon to take the consent, because he has no idea about the procedure. If he has no idea about the procedure, he cannot explain it, and without explaining it, you cannot really take a consent from the patient. So in terms of consent, I hope you got my idea. You have to clear every situation to the patient. Then there is this another scenario where you are enrolling someone to the research and everything, but I think we can discuss it in the biostate portion or research wala portion. We should skip it for now, because there is this one whole scenario there. I forgot to mention the capacity. So yeah, capacity. There is what is capacity? Capacity is the capability of a patient to make a very informed decision, or a decision about his life, or his treatment options, or anything like that. So whenever there is a situation like that, a patient is like on drugs or something like that, what you will do? So there are very variable scenarios or very deviating scenarios, but most of the times what I have seen, you will give him a sedative and wait for him to wake up, and once he wake up, you will ask his consent or anything like that when he is drugged or he is not in his senses, right? Then there is another very typical scenario of capacity. A person comes with the Alzheimer disease, and he has a very typical situation of forgetting things. So what you will do in that case? You will still tell the patient, even though he is not able to understand what do you mean by that, but still you will disclose the situation to him, and then after disclosing the situation, talking to him or her, then you will talk to his guardian or someone else who is accompanying him and her. So making the patient aware of his situation, although he is mentally incompetent, it is must. This might seem quite contradictory to what you might be thinking or you might be hearing, but once you will get to know about the scenario on the question bank, or even on the, I guess it's not on the first page, on the question bank, you will remember my statement at that time. So you always have to make aware the patient of his situation, although he's not mentally incompetent, and then after that you can talk to his guardian regarding the decision or anything like that. So there is this very typical situation कि आप disclose करोगे या नहीं करोगे, you have to definitely disclose the thing to the patient. Now there is this one scenario. There is one situation where a family believes if you tell the patient, it will really affect the patient. Or for example, he's a cancer patient at a very last stage. So should you disclose? You should be disclosing the situation to him or not? So in this scenario, there is very characteristic answer. And in the whole thing, I'm talking about the exceptions or the exceptional things, right? So in this scenario, you will there will be a very prominent option that would be reassess or evaluate the reasoning behind the family member's intention, or try to find the reason why they want not to disclose the statement. So in this scenario, you will try to find the situation, and if in the statement they mention the doctor already probed into the reason why they don't want, so then you will choose to give the patient his required information, because you cannot withhold any information from a patient in any scenario or on any condition, even when the family member is requesting for that. But if it is he is or she is really requesting, you should inquire deep what's the reason for their requesting. And most of the times they only just ask this. They don't get deep into now after you have got to know about their stance, what you should do or something like that. They don't go any deep into that. But mostly they used to ask what should you do. So you should inquire more. What's the reason for them not telling the patient or like that. So this was related to capacity. Okay, there is one another scenario where you will see an option K: send the patient to Dr. X, or send the patient to the previous doctor, or send the patient to psychiatrist, or this ward and that ward for the capacity evaluation. That is always the wrong answer, because once the patient is with you, you don't need to send him anywhere for the evaluation. You have to evaluate yourself if he is mentally capacitated or not. We'll try to end it in 5 minutes, and hopefully we'll end it, because I think there is no much slide. There is this one question answer session at the end, so I guess we could do it on the chat rather. So this was related to capacity. And as far as the capacity evaluation is concerned, the physician who is evaluating the patient is responsible for evaluating the capacity. There will be not any other second body or third body who will be evaluating the capacity. So make sure about that. And how do you check the capacity? There is no very typical situation where they'll say, okay, how do you check the capacity, and what will you do, and anything like that. They don't usually ask these sort of questions on the exam. Next is accepting gifts. So as far as accepting gifts are concerned, okay, we can talk on that. We can talk on that later. So as far as accepting gifts are concerned, you are not you have to maintain your social image, right? So if the patient is really thanking you and giving you some sort of chocolates or some flowers or some very day-to-day thing, you can definitely accept that. But if if the patient is coming to you and saying, "Hey, doctor, you helped me, and now I'm giving you a Mercedes, or I am giving you some sort of a plot somewhere, or some residential area to live in, and etc., real estate or anything like that," you won't accept that. You won't accept any sort of a thing that is financially very expensive or out of the means. But the regular gifts like chocolates or some cupcakes, if it is given with a very good intention by the patient, you can really accept that. So that is related to accepting gifts. There is the whole paragraph is written in the first page. You can go through it and get a very good idea how the scenario is. And usually the statements are very straightforward as far as the gifts are concerned. Then communication, doctor-patient relationship. Yeah. Okay, there are very typical scenarios related to the doctor-patient relationship. I really wanted to discuss them, but really short on time. I hope we can discuss them the very next time we'll discuss them. Usually, once you have established a doctor-patient relationship, you will not be involved in any sort of a personal thing with the patient, or any sort of you could say, for example, dating a patient, or a patient proposes to you, or something like that. So you will totally avoid that. Even if someone was your past patient and he or she was a psychiatric patient, you will even not date after breaking the doctor-patient relationship at that time. But if there is one scenario on your world, if he is not a psychiatric patient, a general patient, and the relation has been ended sometimes before, what you will do in that scenario? If he is a normal patient, a psychiatric patient is an exception. So a normal patient, you can have a relationship with him or her or Joby. So this was very typical scenario I used to see on the your world, right? And as far as the general doctor-patient relationships are concerned, तो उसमें वही beneficence and this autonomy and everything comes and plays in. So you can even write in the chat box in the group keywords specifically you were talking about regarding the doctor-patient relationship. Then communication, there are these two principles. I hope we can continue, and if someone's missing, so I'll definitely put it on recording. So if someone misses, so they can cover it. Anyhow, we were discussing the communication principles. So in your first aid, or even for USMLE step 1 and 2, and even after that, you have these two basic principles. The first one is spikes, and the second one is words. Honestly, I never remembered these principles, but I have understood the concept behind them. But as per the first aid, it highlights these words, right? SPIKES. Like it wants you to remember these. But personally, I didn't. So it's up to you if you want to remember them or not. And and they're the abbreviations of PEARL is abbreviation of partnership, empathy, apology, respect, legitimization, and support. And PEARL is a abbreviation of SPIKES is abbreviation of setting, perception, invitation, knowledge, emotion, strategy. So these are the communication tools, or the communication principles you will be following whenever you are talking to a patient in the relevance of USMLE. So first of all, like you'll see a lot of situations or questions on the exam, or in the question banks, when there comes a patient and he talks about his situation, or some patient he is weeping, and what you have to do in the very first go. Either you have to say, please shut up because I am very busy, I am not here to listen up to you, or you will say, okay, tell me about your situation, or you will ask him about the disease, or you will tell him, only talk about relevant things, I'm not here to listen to your emotional drama and melodrama and everything like that. What you are gonna do? So these are the principles that will guide you or lead you to the right answer choice, and not only to the right answer choice, but ethically they'll try to formulate what you have to do in the different situations. So I'll start with the spikes. So spikes is the setting. The very first thing is a setting. Like for example, a patient comes to you and she's weeping about something, and she says, "I will not survive. I will die," and something like that. And then she says, "Okay, I want to do suicide," and something like. You will not throw a question like, "Why do you want to suicide?" or "What is the reason for your suicide?" or something like that, or "Tell me, how can I treat you?" or "How can I help you?" You will not say that. You will first set the stage for the discussion. You will try to ask, you will try to understand this person, and try to look yourself at her place, and you will say, okay, I can understand your situation, or I know how it feels. Can you now please tell me, okay, what you are going through, and something like that. But first you will set the stage for the thing. Always remember that whenever you get a question, and although the other options will seem right to you, okay, you are a doctor, you are a physician, and you don't have enough time to listen to everyone's weeping and something like that, but you have to set the stage for the further conversation. Then there is perception. You will try to extract the thing or the stuff from the patient. You will first try to listen to the patient, like the open-ended questions. You will say, okay, I'm listening to you. Okay, tell me what brings you here, or something like that. Like you will try to understand the scenario or the context of the patient. You will not straightforward say what you want, what you think, or what you perceive of the patient. You will first listen his point of view or her point of view, and then the invitation is the same thing, and then knowledge. Once you are done with that, then you will give a knowledge-based or some neutralizing statement about the factor, about something, and then you will acknowledge the emotions of the patient that we have already discussed, and then S again stands for the strategy. Like you will talk about, okay, how can we proceed ahead with the thing, and how we can do that. You will not say, okay, this is your disease, and I will treat you this way. No, that's not the right way to do it. You will tell him the possible aspects of the things, and that's, I think every one of us know, okay, how you deal with that. So you will that's the way, and that's the right path you will follow whenever you are interviewing a patient, or whenever you are talking to the patient. And trust me, this spikes phenomena, you will not get to know about it as far as I am speaking or I am telling you. You will get to know about it once you will practice questions. And with every practice question, you will get an idea okay, how you will apply the spikes. You don't have to remember what the spikes is. Even I'm done with my step one. Still, I don't remember the abbreviation of spikes. I have just written it with me. And when I was speaking, I was looking at it and I was narrating the abbreviation to you. So it's really not necessary to remember that, but you should know how to apply that to the question. So this was related to spikes. And then the pearls. Pearls is a partnership, empathy, apology. Okay, apology से मुझे एक scenario याद आ गया. You have a very typical scenario on exam. That is, a patient comes to you and he has to wait for an hour, right? And after an hour, when you come to see him, he's shouting at you, okay, you don't have respect of my time. I've been waiting for you for this long, and you doctors are like this and that. So in that scenario, if you were at fault, you will say sorry, but you will give no explanation about the reason why you were late or anything like that. Always remember that. Do not justify yourself. In every scenario on the exam, whenever there is this sort of situation, you don't have to justify yourself. Oh, sorry, I was busy seeing that patient. I was busy in the emergency department, or I was doing surgery, something like that. You don't have to tell the patient about that. You only Yes, exactly, exactly. You don't have to tell what situation you are in. You will simply apologize, even if it's your mistake, even if it's not your mistake. For instance, the patient was waiting outside, and the receptionist was not there. He was not able to communicate with the patient, but still, the patient was late, and he is angry at you. You will not say it was sorry, it was the mistake of the patient. But if they ask for the reason, still you will say, I am sorry, sir. Tell me, how can I help you? You will never disclose the reason. You will never disclose why you were late. You will never justify yourself. And this is scenario. This is one typical scenario when the patient asks, what is the reason you got late or something like that. And still, in that case, you will simply apologize. Although it seems quite infuriating the patient. He's asking you why you were late, and still you are not disclosing, and you are saying sorry. But that's what you do in the actual exam, and in the actual situation, as far as the right answer choice is concerned, you will not disclose anything. You will just say sorry. You will say apologize, even if it's your mistake, even if it's not your mistake, in either situations, and then you will proceed. How I can help you, and if there is something like okay, sorry, I understand your situation. Now tell me what is your. So वो भी आप अगर इस तरह का option आ जाता है तो then that's also correct. So that's how you will deal with that thing. Then respect है, legitimization है, and support है. What do you mean by respect? Respect का ये है कि you will not be non-judgmental to the patient. For instance, a patient comes to you and he or she is homophobic, right? And you ask about the gender of the person, and it might seem humiliating the patient or the person. So you will avoid saying him like if he is into men. So you will avoid saying his or her pronoun. You will first ask sir, what is the possible pronoun I can call you in, or I can refer you to. So then, according to his or her reply, you will further reply back and further lead the conversation. So that is the respect, or being non-judgmental about the situation or things. Then there is support. So yeah, there is this one patient. He is crying in front of you. You will really give him time to get himself into his place or her place, and then you will further proceed with the thing. You will not be like that. Okay, I'm wasting my time or something. So as you'll practice questions on the QBank or UWorld or even NBMEs, you will get a very subtle idea how you will tackle the situation. It only comes with the practice. Trust me, whatever the scenarios and situations I know right now and I remember, it's just because I have practiced them. So make sure that you do really practice of them, and keep the principles at the back of your mind whenever you are answering a question. And then interpretation, yes. To disclose about my exam, I'm not going to disclose the very exact scenarios in my exam, but I got a lot of questions from interpretation, and this topic is written in the first aid. And before my exam, I really used to think this topic is not that much important, I should not study it very well or something like that. But once I gave my exam, I really got 3 or 4 questions from this interpretation wala topic. So make sure you don't leave any topic in the first aid, or you count as unimportant or something like that just because you haven't heard anyone saying about that topic. As far as ethics is concerned, yeah, you do remember a lot of scenarios. The scenarios I've been talking about, most of them are in UWorld or on Amboss. They're not that much straightforward on the first rate. So yeah, that's the power of practice, and that's a strength you'll get after you'll practice questions. You will in the back of your mind, you will get to know, okay, this is this particular scenario, and the situation is something relevant to that scenario. So I can generate or synthesize an answer that was something associated to that option. So yeah, whenever you will hear anyone giving an advice about the ethics portion, he'll definitely be saying practice, practice, practice. Practice is like literally so important for these questions to get a very big idea about the concepts and exceptions and the scenarios. So interpretation may you'll see a patient. I can share some scenarios. For instance, you will see a patient, and she is Caucasian, or she is some non-native speaker, or she's not good at English. So what you will do as a doctor? There will be different choices. Number one would be if there is some nurse standing nearby, and she will offer to translate it for you. There is some daughter of a patient or some relative of a patient accompanying her, and she offers to translate it for you. And then the other options would be you seek help from the professional staff or something like that. So always remember, whenever you are doing the interpretation thing or communication thing with the patient, non-native speaker, you will always try to seek help from somewhere who is who's not going to influence the situation or the communication. So you will take help from someone outside, like some communicator or some sort of a online communication tool or some language translator tool, rather than relying on some nurse or some technical staff or some relative of the patient. Always remember that situation. You will always go with the professional approach or professional help. And if you don't get a professional help, you will try to get it. For example, there is this one scenario on the patient bank where there is a patient comes in the night and emergency department, and there is no one else to translate for him or her, and you are given the option, there is one nurse who can communicate for you. And there is one other option where they say the patient is in a non-critical situation and you can wait for the morning. So in that situation, you will wait for the morning. When there will be morning, there will be a proper assigned interpreter in the hospital. Then you will proceed with the calling. But if in the case there is this emergency situation, or for example, the patient had some sort of a knee trauma and he is in a very extreme pain, and you are not able to communicate with the patient, in that scenario, you will try to seek help from the online tool or some remote tool. And when there is all these options eliminated, then you can take help from a student or some relative or nurse. But most of the times they don't get reach to that point. You will always be seeing an option where they'll mention some online tool, some telephonic help, wait for the morning if it's non-critical situation. So choose accordingly. But the main principle is to always seek a professional way rather than relying on some relative or some kin of the patient or some random technical staff around you. And then फिर उसमें disability वाला person है तो तब क्या करना है? You have to give him some margin, like try to give him some more time. उसके अलावा do revise the statement in front of him so he or she can better understand the statement. Other than that, if someone is like really disabled, like he cannot even speak and hear, like the deaf and dumb, then you will have the interpreter. Then they specifically ask कि interpreter को कहाँ पर खड़ा होना चाहिए, doctor के adjacent होना चाहिए, patient के adjacent होना चाहिए. ये first aid में सारी चीजें लिखी हुई है. You will once you skim through the first aid, you will get an idea about that. But ये वाली चीजें भी यहाँ communication और इंटरप्रिटेशन में आ जाती हैं आपकी.